Hi, I'm Dr. Gloria Richard Davis. I am a reproductive endocrinologist and infertility specialist, a professor in the Department of OBGYN at University of Arkansas Medical Science. I'm also executive director for the Division for Diversity, Equity, and Inclusion. So for women who are planning to become pregnant, there is no reason that they cannot get the vaccine. In fact, it is recommended that they get the vaccine because should they become pregnant, it reduces the risk of them contracting COVID-19. And what we know about COVID-19 in pregnancy is that pregnant women have an increased risk of being hospitalized. About 31% of them are. They have an increased risk of potentially being admitted to the ICU and an increased risk of ventilation. So you want to avoid that at all cost. And the best way to do that is to get the vaccine before you're pregnant. If you happen to already be pregnant, you still should get the vaccine. The vaccine is not a live virus. It has no bearings on the pregnancy at all. And there have been reports that women who have been vaccinated, their newborns may in fact be born with antibodies protecting them from COVID-19.
It's very likely the COVID vaccine provides some immunity for the nursing baby based on what's already known about immunity with other vaccines in breastfeeding. One recent small study involving the results of about 10 women who were vaccinated during pregnancy and tested immediately after delivery showed they had antibodies to the COVID virus. This is encouraging news.
For mothers who receive the COVID-19 vaccinations, early studies are showing that they in fact do develop antibodies and transfer some of these antibodies to the newborn. Ongoing research will have to determine how effective that is in preventing severe disease, but at this time we're certainly encouraged by the information we received.
The American Society of Reproductive Medicine, which is our national professional organization, has been very deliberate and focused on making sure that that question is answered. And the answer that we have is that the COVID vaccine has no effect on future fertility, and there should be no concerns for women who are of reproductive age to take the vaccine. So with planning pregnancy, the recommendation is, well, there are a couple of things to consider. With COVID vaccines, the side effects or the adverse effects may include like fever or chills. So if you are undergoing any type of invasive procedure like in vitro fertilization, for fertility, the recommendation is that you not get the vaccine 3 days before and 3 days after your retrieval. But that's simply because we don't want to confuse the symptoms that you may get after the vaccine with any type of infection related to your procedure. Otherwise, there's absolutely no timing issue with your attempting to get pregnant and getting the vaccine.
If you're pregnant or breastfeeding, you can receive the COVID-19 vaccine. You should have a conversation with your healthcare provider if you have questions that need to be answered. But yes, the vaccine is available to those individuals.
Post-vaccination, it is safe to become pregnant at any time. There is no amount of time that you have to wait because, again, it's not a live vaccine. It simply boosts your immune system so that you are protected from COVID-19. It does not affect your future fertility, and certainly in the immediate post-vaccine, there is no reason to not get pregnant.
It's important for every eligible person to be vaccinated because vaccines have proven to be safe and effective and has pulled this country through many difficult times in the past. And our science, technology, and evidence support the efficacy of the vaccines that we currently have available. They represent the best path that we have back to normalcy.
Pregnant women in particular should ask their physician about their health care considerations to ensure that they're comfortable with receiving the vaccine. But health experts recommend the vaccine for both pregnant and breastfeeding women. I think the vaccine is important for protection of themselves, their families, their children, and everyone else that they come in contact with.
What I would say to women is that the vaccine is very safe. We know that we have, millions of women in this country who have had the vaccine, and the vaccine safety monitoring system works very well. If there were anything at all, any even small signal of there being a problem with it, we would know that by now. And so I encourage all women, reproductive age or non-reproductive age, to please get your vaccine.